When?
Jen and Amy in the Jefferson ED at 4 a.m. Rocky is the patient. Amy, I need your help in room 4, stat. Patient is a 65-year-old male complaining of shortness of breath and is in apparent respiratory distress. He has a history of diabetes and is starting to freak me out.
Let's go see what we have on our plate.
I think our next step is to get an arterial blood gas.
Crap! I have pregnancy brain and I'm hungry, so let's think back to the past and good old lab med with Jessie Cole.
Jen and Amy in class with Jessie learning ABG. Paul is the fake patient.
ABG stands for arterial blood gas, people. You do it when a patient is in respiratory distress, organ failure like liver, kidneys, or heart, hyperglycemia, or to check some acid-based stuff.
Okay, so what is going on? What am I in here for?
Well, Paul, we're first going to feel for your radial artery and stick a big, scary needle into your artery and get some blood to take a look at.
That sounds fantastic.
Hold on, people. Riddle me this, Batman. You are forgetting something before you stick a guy with a needle.
All right, Jessie, we should probably make sure that he has collateral circulation in his hand, all right?
Great. It is almost as important as me having my Mountain Dew before a long night in the ER.
Just stay calm. Calm down. We're back. My hand. Emergency department with Jen, Amy, and Rocky. We need to do an ABG on you, Rocky, to test your blood levels of pH, carbon dioxide, and bicarb. Before we can do this, I'm going to perform an Allen's test. Oh, I know exactly what that is. I mean, I'm 65 and I could probably do this on myself. In that respect, go right ahead.
Now, this may hurt just a bit, but I mean, I've been through childbirth. I think you can handle a little bit of pain, Rocky.
Fine with me. Now that I have Medicare, I'm smooth sailing. And remember, this may or may not tell us anything about you. Classroom with Jessie and students.
So how exactly, in what orientation, in what fashion does my arm need to be for this test?
Well, you need to hyperextend your wrist so that we have a clear view of the artery and pulse. As you insert the needle, make sure that the bevel is upwards and you enter the artery at a 90-degree angle, and then you'll see the syringe fill like a vacuum.
What do you do after the syringe fills with blood?
You have to make sure that you put the sample on ice and send it to the lab.
So what are some of the complications of this procedure?
Well, the patient could possibly develop a hematoma, thrombosis, arterial spasm, nerve damage, and a lacerated vessel in severe cases.
That is very fascinating, but super scary.
Back in the emergency department with Amy, Rocky, and Jen.
Great job, Rocky. I hope that didn't hurt too much. I'll let you know when the results are in.
This is all really cool stuff. Thanks, guys. Classroom with Jessie and students.
You all need to remember when not to do an ABG. The contraindications include cellulitis, an abnormal Allen's test, peripheral vascular disease of a limb, severe coagulopathy, and if someone is on heparin or warfarin.
I want to see in here. Can we get to the exciting part, Jessie? This stuff is putting me to sleep. That's actually kind of funny.
Yeah, tell me what an ABG means.
All right, Jen, can you tell me what a pH is?
pH is a measure of hydrogen ions in your blood and is normally 7.4. If it's above 7.4, it's called alkalotic, and if it's below 7.4, It's called acidotic.
Great. Now, Amy, where does carbon dioxide come into play here?
All right, the normal level is 35 to 45, and it tells you if the patient has an underlying respiratory cause or if their pH has changed.
Wonderful. Now, Rocky, tell me what bicarb is.
Bicarb buffers the pH, and it tells you if the patient is having an underlying metabolic issue that is causing their pH to change.
Well, we're going to be this. How do you interpret the values?
Well, Dr. Carey taught us this really neat trick. It's called Rome. I've never been to Rome, but I sure do love pizza. And so I digress. So for Rome, it's respiratory is opposite, metabolic is equal. So if the pH is increased and the CO2 is decreased, it's respiratory alkalosis. If the pH is decreased and the CO2 is increased, it's respiratory acidosis. Then for the ME, if the pH is increased and the bicarb is increased, then it's metabolic alkalosis. If the pH is decreased and the bicarb is decreased, it's metabolic alkalosis. See?
Truly, that's super!
All right, well, that's a wrap.
Now, everyone go chill out and lick a Valium.
Thank you for watching. Now, okay, so first we have Jessie Cole as the teacher. Then we have Rocky as our student. Next we have Amy as our PA and student. Then we have Jen as our other PA and student. And finally we have Paul as our student.